Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Horizontal gaze center. Horizontal gaze center is located in pons called as pontine parareticular formation. So this it is located in pons at pontine parareticular formation. This pontine parareticular formation controls the lateral rectus present on the same side, whereas medial rectus present on the opposite side is controlled by the medial longitudinal fasciculus. So there is actually, if you see, there is a horizontal gaze center. This horizontal gaze center in pons, it is also called as parapontine reticular formation. This will control the same side or ipsilateral lateral rectus. So for the conjugate eye movements, so if the eye has to move like this lateral rectus has to move, and here the medial rectus, here the medial rectus has to contract, here the lateral lateral rectus has to contract. See, when the eye is moving this side, so it is better if we see the opposite side, right? So if the eye is moving this side, that means this side lateral rectus should contract and this side medial rectus should contract. So for the for the eye, ipsilateral lateral rectus is controlled by parapontine reticular formation, whereas the other eyes or contralateral medial rectus, it is controlled mainly by medial longitudinal fasciculus. So if there is any lesion in this medial longitudinal fasciculus, then this medial rectus cannot move. So when the eye tries to move this side, this eyeball will move, but this will not move. So this is called as internuclear ophthalmoplegia. So whenever there is lesion in the medial longitudinal fasciculus, this will result in internuclear ophthalmoplegia. So what is internuclear ophthalmoplegia?
thank you and thank you for watching.